everyone. Can you guys hear me? Okay, well, we're going to get started. This session begins at 1 o'clock. We're a few minutes past 1, so we're going to go ahead and get started. Is it recording now for you? Yes? Okay, great. So, my name is Julie Tolbert. I work with Alliant Insurance Services, and we're the broker. And we have a few folks in the room. I'm going to do introductions. We've got supplies, and there's feel free to roam around or to ask questions, but we will also help you at the end gather material that might be more relevant. Some material might not be if you're not interested in a certain plan, but with that, we're going to get started. So again, my name's Julie. I work with Alliant. We have Nicole Henry here from Sisc, and she has been out here multiple years. She's going to talk about the medical programs. We have Selena from Anthem, and she's going to talk about the dental plan that's with Anthem, the vision, and the life insurance. And then we have Julie from Delta Dental, and she'll get up and talk about the Delta Dental. We're not going to get in depth on, all the different co-payments and plans. We're going to try to keep the meeting on track for you. This is your annual open enrollment. So with that said, we're going to get started. And this meeting is for you guys, so feel free to ask questions, raise your hand, it's interactive. If anyone has anything, real personal, while you can pull any one of us aside and we can help you, or you can stay afterwards and speak with one of us. There's a few of us that do have to skip out to another meeting, but there will be plenty of assistance following this session. Any questions so far? Nothing? All right, well, we'll get going. So with open enrollment, this is your opportunity to make changes to your benefit program. This is your annual open enrollment. Everything that we talked about today is effective October 1st, so this is the time of year you can switch between medical plans, switch between dental plans, or you can leave everything as is. And if you leave all of your elections the way that they are, you're happy with your current plan choices and coverages for yourself and any of your dependents, you do not need to fill out any forms. That's the good news. Easy peasy. If you want to make a change between medical plans or dental plans, or update your beneficiary, then please see Misty, and she will help you with the appropriate form to make that change. Okay? All right. So on this slide, this shows at a glance all of your benefit options that we're going to talk about today. So you have medical with Sisc, that is still with insured by Blue Shield, and there's 4 medical plans to choose from. This year there is one change to one of the plan options. I think last year there was a change to the 80% plan. This year there's a slight change to the 90% plan. Okay, so you want to really look at this because prices have gone up. You've all received your different schedules. You need to look between the different choices to see what makes most sense to you. And that would be a combination of how much you're going to pay in premium versus how much you might pay out of pocket in your medical plan choice. So some folks are looking at the 90% plan versus the 100% plan. Take a look at that. Nicole's going to go over the slight change in the 90% PBO plan. With that said, how many in here are covered under the HMO? Okay, so with the HMO, there's absolutely no change in the benefit schedule for the HMO plan. Okay, and then the rest of you are on, how many of you might be on the 100% plan? Okay, so, and then so on. So, again, there's only one slight change on the 90% plan, and that's the office visit copay. We'll talk about it again. Nicole will go over that towards the end. We're gonna do the medical towards the end. So we're gonna talk about, you have dental, 2 dental plan choices, and there still remain the DHMOs with Anthem and Delta Dental has the PPO. You still have a vision plan. No changes to the Blueview Vision, that's through Anthem. You have an EAP that's also through Sisc, that's provided to all members. Nicole will go over that the EAP is provided to all of you and your household members, regardless of being on plan or not, or your dependents being on plan, they're covered under the EAP. You have a basic accident, AD&D, plan through Zurich. That's also through Sisc. That's in addition to the life insurance benefit that you have with Anthem. So you have a $50,000 group term life and AD&D plan with Anthem. And then you have flexible spending. Flexible spending is not open enrollment right now for flexible spending because that runs on a calendar year. But we'd like to pull it into the presentation because it is a benefit to consider while you're making your benefit choices, okay? So to get started, I'm going to skip through. We're gonna start with Selena from Anthem, and she's going to address the DHMO. This slide up here is just a basic reference of the difference between a DHMO and a PPO dental plan. How many of you are covered under the DHMO plan now? Okay, one. Okay, so with that, Selena's going to talk about the DHMO plan, and then she's also going to move on, since she is from Anthem, she's going to talk about the vision plan, and then briefly about the life. And then Julie will talk about Delta Dental, and during the presentations, they'll address the differences between DHMO dental and the PPO.
Good afternoon, everyone. Welcome. Just like Julie mentioned, your plans did not change. Through Anthem Blue Cross, you have the DHMO option that you will have to select. That plan does not have any deductibles. It doesn't have any maximums. You will have to select a provider in the network. It has a flexibility that if you select a dentist right now and later on you want to change to another dentist, you can do that. But it doesn't have an out-of-network option on the DHMO. So one of the flexibilities of this plan is that it allows you to change providers. You can all have a different dentist in the family. There's no claim forms to fill out. There's no co-insurance. You have a set dollar amount depending on what services you're having. And those are based on co-pays. In the table in the back, I do have a complete benefit summary for all the 3 plans that are offered through Anthem, the dental, the vision, and the life. So if you're interested in picking up any of those, if you want to look at the DHMO plan and see what the co-pays are, feel free to do so. But it is a plan that allows you to, again, see a dentist in the network. You don't have to worry about submitting claims, about the co-insurance, about any maximums. You just have to a co-pay based on the services that you are having done. And again, that's one of the plans that also allows you to change dentists if you want to do so throughout the year. All your preventative care work, your basic cleanings, your x-rays, all those are covered at 100% under the plan. And orthodontia is an option, both for children and adults. Are there any questions on the DHMO dental? And again, the plans didn't change. Yes, ma'am.
And if I have a child that's an adult dependent, that's over the age 18,
yes. So they are covered under the plan as long as you have them under their dental.
They would have the adult copay.
Yes, if they're over the age of 18,
Okay.
they would have the adult copay.
Yep.
Was there another question?
Is the provider list online or?
The provider list is online, and when you go into our main page, anthem.com/CA, under provider finder, you can put a zip code or the dentist name, and then look up under dental plans, and then dental net, which that DHMO plan that's available to you. And you can email the listing directly to your email, so you'll have that listing available to you. Okay. Anything else?
If you wanted to change, what's the deadline?
Or to change dentist, you can do that every month, the 15th of the month.
I'm a delta right now. If I wanted to change to dental, if I see it more beneficial to me,
What
what is
is
the
the
deadline to change?
Okay, so that's a really good question. The changes for medical absolutely have to be in by the end of this week to Misty. So for the medical and dental, we have a little more flexibility. And Misty, do you have a deadline for receiving changes for Anthem and Delta Dental? We have a little more flexibility in that. The deadline is absolutely at the end of the week for medical. But do you have a set date?
September 13th.
September 13th.
Thank you.
Anything else on the dental plan?
Yes.
Okay, your vision plan is also offered through Anthem Blue Cross, through the Blue View Network. That did not change. This is a PPO vision plan, so it does allow you to see providers out of the network if you wanted to do that. Your eye exam is once every 12 months, and that is based on the last day of service, not necessarily on your calendar year or plan year. There is a $25 copay for your eye exam. Your lenses and your frames are also every 12 months, and you have a $130 allowance towards your lenses, towards your frames or your contacts, and then a 20% off. Anthem mainly contracts with the retail stores like Sears, like JCPenney's, Target, Pearl Vision, Lens Crafters, but we also contract with independent providers as well. So if you wanted to see what providers are in the area, you can find that on our website. Some of the Costco stores are also part of the network. If you have a provider that you go to that is not in the network, you can still see that provider. There is a reimbursement amount for your eye exam and for your materials. You will have to pay up front for those services and then submit a claim to Anthem Blue Cross to get reimbursed up to the reimbursement amount on the vision. And again, this plan didn't change. It's the same that you had in place. So if you're already enrolled, you're automatically going to roll over into this plan. And then lastly, the last benefit that you have is your basic life insurance. That is with Anthem Blue Cross. If you can't remember who you have as your beneficiary, maybe it's time that you go and see Misty, make sure that whoever you want to designate as your beneficiary for your life insurance is what you have on paper. It is a $50,000 flat benefit, both for Class 1 and Class 2, and there is a reduction amount if you reach the age of 65. Under your life insurance, you also have the AD&D benefit, which is the accidental death and dismemberment, where we pay another $50,000 if your death would be a result of an accident. So again, if you can't remember who your beneficiary is, it's a good opportunity for you to look at who that person is, and if you need to update that, you do that now. And it's open format.
Is that seen online? The beneficiary?
You want to check with Misty on that? I don't know that you have that information online. It would probably be in personnel file. Yes?
Is there an option to buy so that you have more for the?
Not through Anthem. I don't know if that's another option. Right now, it's just the basic life insurance. Anything else?
Okay.
All right.
I'd like to mention that if you didn't get an opportunity to grab an updated 2013 Anthem booklet, they are in the back. So when you leave, grab one. This contains the DHMO, but it also contains the vision and the life insurance benefit and some other helpful details and services through Anthem, such as for the life insurance, there's a travel assistance program, and it's located in your booklet, and it talks about, it helps you when you're traveling and something should happen to you outside of the area. And it's in addition to coverage for your medical plan. We'll talk about coverage under the medical plan when you need services while you're traveling, but this is a nice concierge service so that if you're traveling and you lose your passport, your wallet, you need help in a foreign country, they're able to help you. So if you're planning on travel, this is what we suggest, but if you're planning on traveling, let Misty know, HR, or go online and look at the different flyers that are available to you. There is one for medical about traveling and how to seek services, and then there is the travel assistance flyer that you can put in your luggage, take with you, and it's very helpful if you need to use something, if something were to happen, okay? With that, yeah, thank you, Selena.
Thank you.
Yeah, so with that, we're gonna turn it over to the expert over here to go over the medical plans, and she's gonna talk about the new, the slight change on the 90% plan, and just the differences between all four.
Thanks, Julie. My name is Nicole Henry, and I work for Self-Insured Schools of California. We're the JPA that administers your health benefits through Blue Shield. So what I'm going to do today is talk about the different plans that you guys have available to you, medical plans, the difference between an HMO and the PPOs, and just some extra benefits that you may not know about for being on these Sisc Blue Shield plans. So what I wanted to start with was the difference between an HMO and a PPO. First I'll start with an HMO because it's a really easy benefit to understand. This particular HMO that's offered by College of the Desert is very, very rich, which means the member doesn't pay a whole lot at all, really. There's a $10 office visit copay on this plan, a $100 ER copay, and there's other kind of off charges, but for the most part, other than those two dollar amounts I'm talking about, you don't pay anything as the member. So that's really great, but the drawback to an HMO is that you have to select a primary, and it may not be a drawback to everybody, but some people see it as a drawback. You have to select a primary care physician that participates in Blue Shield and a medical group of which that doctor is a part of. Now, that doctor that you select is in charge of coordinating your care and making sure that you're getting the care you need and providing all the needed documentation to the medical group to authorize your care. So everything that you need regarding your health benefits has to be authorized by your medical group and best be coordinated by your doctor. So if you have a good relationship with your doctor and medical group, HMOs can work really well for you. It's really, really easy. $10 copay. On the member's part, there's not a whole lot for you to do. Everything's kind of taken care of behind the scenes. You need x-rays, labs, surgery. Everything's taken care of for you behind the scenes. But you are, I wouldn't say at the mercy of, but you need your doctor and medical group's approval for everything you do. They will manage your care, they will tell you where to go and who to see, and when to see them. But again, if you're okay with that setup, it works beautifully. This is a really rich plan, $10 copay, very, very rich. Now the PPOs, which I understand there seems to be more people on the PPOs than the HMO I've noticed. But the PPOs are different in that with a PPO, you have great freedom and flexibility. You do not have to pick a primary care doctor. You do not have to pick a medical group. You can actually go see any provider that you'd like. There's out-of-network benefits and in-network benefits. Now, in-network benefits are referring to contracted providers with Blue Shield of California. Blue Shield has a huge network. It's not difficult to stay in the network. But the nice thing about a PPO is if you wanted to go see a doctor, maybe who doesn't take insurance, you could get some reimbursement. Now, just a warning, reimbursement is much, much lower when you see someone who's not in the Blue Shield network. So by all means, if you can possibly stay in the network, I would encourage you to do so. Of course, not compromising your health care, but if you're looking to decrease or minimize your out-of-pocket costs, stay in the network with Blue Shield. I know sometimes it's out of your control. When that happens, if it's an emergency and that happens, our plan reimburses significantly more. We reimburse Blue Shield full allowable rate. But if you're out of network, they can still charge you more on top of what we are reimbursing. And again, if it's an emergency, we reimburse higher. If it's not an emergency, then the reimbursement is very low for out of network. So it's just a warning to you. And I always recommend if you're on a PPO plan, you have that responsibility now to ensure you're in the network. Not like on an HMO where they make sure you're in the network. Now you're on a PPO. You have to make sure you're in the network. So everyone you see, you ask them, are you contracted with Blue Shield of California? And you can even go a step further and say, if you're going to send out my blood to a lab, or if you're going to send me somewhere, I want to ensure that I'm seeing contracted Blue Shield providers. And if I need to go to someone who's not contracted, that I'm made aware of it ahead of time. And that's just part of being on a PPO plan. You have to be more of a consumer. You have to be more diligent. You're constantly tracking things and ensuring that you're getting the care you need from Blue Shield contracted providers. Again, don't compromise your care by going outside the network if you need to, but if you're trying to control your costs, Blue Shield is a huge network. Do everything in your power to stay within it. It just makes the most sense. It's how the plan's intended to be used, but it does have the flexibility to go outside. That said, nationwide network of providers. If you're out of state, you can go see a specialist in New York if you want. That's the beauty of the PPO. You have great flexibility to go wherever you'd like. And if you're in a different state, you use the Blue Cross Blue Shield network of that state. So it's really, really great. Now there's 3 plan options here. Now all 3 plan options, so there's the 100%, the 90%, and the 80%. All 3 plan options cover the same things in the same manner. So if it's covered on 100% plan, it's going to be covered on the 90, it's going to be covered on the 80. What the difference is how much, one, you pay out of your paycheck for it. So take that number, first of all, when you're deciding what plan you want, take that number, the differences between the plans over the course of a year, and back that up against, okay, if worst case scenario, and my family needed to use the services, how much would we be paying out of our pocket? So it's kind of like a math equation. Here's where I'm paying my premium out of my paycheck versus here's how much potentially I could pay if I need to use the services. If one's outweighing the other, then there's your choice. If they're close, you have a decision to make. But that's what we recommend everybody do. Do the math. Math doesn't lie. There's a little bit of gambling, I like to say, involved with it. It's particularly if you go to one of either the 90 or the 80, even the 80 especially. And the math, if it's close, then there's a little gambling involved, because if you take the 80% plan, that doesn't cost you anything. And correct me if I'm wrong, doesn't cost you anything for the 80% plan, right?
Right.
Yeah, okay. So if you take that, think, okay, I'm saving a lot of money over the course of a year, and if I never get sick and never need to use the benefits, I just won. I won, you won the jackpot at the casino, it's a bit of gambling involved. So. But then you also have to take that risk if you take the 80% plan. Okay, if I do need to use the services, here's what I could potentially be at. So anyhow, that's how you should look at these plans when making your decision. In the 100% plan, well, first of all the PPO plans have an office visit copay. 100% plans is $20. The 90 and the 80 both have a $30 copay. And that's actually new this year. The 90% plan last year had a $10 copay. That is going up to $30. So anyone on the 90% plan, and if you stay on the 90% plan, any visits after October 1st will now be $30 as opposed to $10. So just know that. So 100% plan is $20. The 90 and 80 are $30. Now, if you want to do something other than an office visit, or you need to do something other than an office visit, like an x-ray or a lab, an MRI, surgery, whatever it is, you're designated to pay your deductible for that plan before the plan starts paying anything. On the 100% plan, that deductible is $300. On the 90% plan, that deductible is $200. And on the 80% plan, that deductible is $500. That's the amount that you pay annually towards your care before the plan starts paying anything.
That's per person?
Per individual, thank you. Per individual.
Families, it would be free if it's free.
Yeah, well, we actually have maximums for families. So, but it's only a maximum. It's not like just because you're a family, you have to reach the family. It's just a maximum to protect you in case 3 or more people need to use the benefits. Yeah, and the families, just so anyone is aware, on the 100% plan, the maximum deductible for a family is $600. On the 90%, the maximum for a family is $500. And on the 80%, the maximum for a family is $1,000. And that's deductible. So once the deductible is satisfied, then the plan kicks in at the given percentage. The 100% plan, I guess you could imagine, it pays 100% once you meet your deductible. As long as you stay in the network, your bills will be covered at 100% from that point forward, and for the remainder of that calendar year. On the 90% plan, as you can imagine, the plan pays 90% after you meet your deductible. So the deductible is $200, and then you pay 10%, and the plan pays $90. But I know 10% is scary because 10% of a hospital bill can be a lot of money. But your 10% is actually maxed at $300 per calendar year. So for instance, on the 90% plan, you would first meet your deductible of $200. Once you've met that, you pay 10% of the remainder of your bills. If your 10% should get up to $300, at that point the plan turns into a 100% plan for the remainder of that calendar year. Your 80% plan, or plan 3, this one has a $500 deductible like I spoke about earlier, and again, this one pays 80% of the bill. You pay 20%. Again, 20% can be scary, but it is maxed at $1,000. I'm talking individual amounts right now. So on this plan, you meet your deductible of $500, then you pay your 20% up to $1,000 per calendar year. If you should get to these maximums and meet them, then the plan would turn into a 100% plan from that point forward for the remainder of the calendar year. So I'll just give a brief example for the 3 plans so you can know. If you had a surgery on plan A that was going to be pretty costly, you're going to pay your $300 deductible towards that, then the plan would pick up the rest. On plan 2, or the 90% plan, you're going to pay your $200 deductible, then you're going to pay 10% of the bill. It's going to, if it's a costly surgery, it's going to reach your $300 maximum. So if you add the $200 deductible plus the $300 maximum, you've got $500. So you've paid $500 for that same surgery on this plan. Now over to this plan. This is the 3rd plan, the one that doesn't cost you anything. This one, $500 is your deductible. Then you're going to pay your 20%, and it would probably reach $1,000 if it was a costly surgery. So you're out $1,500. The $500 deductible plus the $1,000 co-insurance max. So this plan was 3, the 100%. The next plan over was 5, and then the 80% plan is $1,500. So take those dollar amounts in mind and compare them to how much would I pay for them out of my paycheck. You know, yes, you're paying $1,500 should you need the services on this plan, but how much would you pay for it over the course of a year? Same goes for the 90% plan. Yeah, I'm paying this much, but I'm only paying $500 as opposed to here where I'm paying $300, yet I'm paying over $1,000 just to be on it. So just be a good consumer and try to be educated and make a good decision. Yes?
We received a table that showed what we'd be paying out of our paycheck, but I didn't see anything that identified it as for individuals or for family coverage. Do you know on that?
Yeah, you can, as an employee, the rates for this school district are what are called composite rates, which means it costs the same to cover one person as it does a family of 10.
Okay,
So, yeah, the only individual family pieces that I'm speaking to are the out-of-pocket when you use them pieces, because that is per individual. Yeah, and there's maximums, and we've got the documents over here that go over all the maximums for a family. But the important piece is to really look at the individual amounts. The family maximums are simply protection from one family having to pay too much money. So that's basically how you would compare the 3 plans. They all have the same prescription drug plan, $7 for generic drugs, copays for a 30-day supply, and $25 for a brand name 30-day supply. Now, reminder to you, or for those of you who don't know, you can get your generic drugs for free at Costco. They are absolutely free. There's no cash. There is an exception, though. It is narcotic pain medication. Other than that, you can get your covered generics for free at Costco. You don't even have to be a member. You just tell them that you're going in to use the pharmacy. They can't keep you out for that reason. So when they ask for your card when you're walking in, you say, I'm using the pharmacy, and they will wave you on through. That's a little secret if you want to just look around and you're not a member. But no, it's true that it's a state law. They can't require a membership to use a pharmacy. So they will let you in the door to use the pharmacy. You just pay up there at the pharmacy, then you walk out. So I'd recommend anyone who can make it to Costco, save yourself some money, and get your generics for free there. Another benefit added to all the PPO-only plans, it's called MD Live. And this is a really cool benefit we just added this year. It's 24/7 access to board-certified physicians. It's a $5 copay. You just make a phone call and you get to speak with, again, a board-certified physician and have your consultation or office visit over the phone or via a web chat. And they will actually, if the need be, prescribe medication and call it into a pharmacy for you. Amazingly successful program we've had with it these last 8 months, and we hope to continue that. So again, obviously, if you need some kind of chronic condition care, see your doctor in person if that's what the case may be. It doesn't take the place of that doctor-patient relationship, but it's a benefit to you if it's something convenient, it's something simple, you don't have to leave the comfort of your home. If it's like sinus infection, earache, pink eye, urinary tract infection, things that can be handled with a phone call or a web chat, you'll save yourself the copay, you'll save yourself the gas, you'll save yourself the time, they'll call it into the pharmacy for you. It's amazing, and I'm a person, I gotta admit it, I'm lazy, and this is convenient. This is so convenient, so I just recommend you take advantage of it if you can. Especially young children. I've got young kids, I've used it for them multiple times. It's been amazing. So use it, the number's on the back of your ID card. This is the flyer for it, I've got flyers back here if you guys want to take them home too. Put it on your fridge, and when someone gets sick, they'll say, oh, I'll call that doctor right there. I wonder if he really looks like that. He probably doesn't. He's a good-looking doctor. I don't think he's a doctor at all. He's probably a model. But it's
So it's not a computer, it's a person.
It's a person, yes. Yeah, and if you're not comfortable with the phone call, that's where the web chat comes in. Yeah, but I'm comfortable with the phone call, and I've used it myself, and they really spend some time with you. So it's a cool program. Also, in addition to that, we have an Eap program, or Employee Assistance Program. That's this flyer or brochure here. I do have some of them over on the table over here. All Blue Shield members are eligible for this. And what it is an employee support program. And one of the best features of it is each employee gets 6 free visits with a licensed therapist in their area for you and all members of your household, whether they're on your plan or not. So if you have a niece or nephew or an elderly mother living with you and they could use some therapy, I think everybody could use someone to talk to. Free, 6 visits per situation. It's really, really cool. Free to you. Also free 30-minute consultation with an attorney over the phone, free financial planning, really cool support system. Again, the number is on the back of your medical ID card with Blue Shield. Yes?
Hi, I'm sorry, I have to leave to
Yeah.
teach in just a few minutes. The amount that we pay out of our paycheck, where is that amount? I heard someone mention a table. I
Send her
don't
an
have
email.
it.
From
Is it
Misty
in one of
before.
Misty's emails?
Yeah, but I'm not sure if that was the official one or it's like a tentative.
Does anyone
Misty
have it? Misty, can you tell
And there
us?
she is. The payroll deductions for the 3 different plans.
You don't
I
have
don't
it?
know, I don't know what medical plan you're on, I don't know what dental plan, I mean, there are so many variables, but
When
Is
was
there like a
it
chart?
sent out? Like
when was what sent out?
the information that people are referring to?
I think she just wants to know how much, when she's making her decision for next year, she just wants to know the difference between the costs on the different plans.
Thank you for.
Yeah, and the classified, you just voted on something this morning.
There we go.
Yes, ma'am.
Does that help?
Yeah, this
Good.
is exactly what I
Yeah,
was
so
looking for.
we use this information on there when you're making your decision. And write it out on a piece of paper or an Excel spreadsheet, compare it, and say, okay, here's how much I pay over the course of a year, here's how much I could potentially pay if I need to use the services. And if you think, you know what, I'm probably not going to need the services this year, then there's your answer as well. And that's pretty much it. Oh, one other addition, we have an AD&D life policy. Automatically, all of you for being on a Sisc plan are enrolled on. It's important for your family members to know about it. It's in addition to the Anthem life policy that Selena was talking about earlier. It's, again, all for Sisc members, $10,000 AD&D policy that you all have and you may not know about. But God forbid something should happen, let your family know that you do have this benefit. And it's just an additional $10,000 if it were to be an accidental death or a dismemberment of some sort. And that is it. Are there any questions on the medical plans through SISC? Yes.
Remind me again, that age guideline for adult children, it's 24, is that right, or?
It's 26, up to age 26.
Up to age 26?
Yeah.
And
First of the month following your child's 26th birthday is when we would take them off the plan.
okay, and so after 26, is there a rider or anything like that where if you want to choose to pay additionally or whatever, you could do that? Or it wouldn't be a rider to this policy? It's a separate?
They would be eligible for COBRA,
Right.
but there is no rider to continue coverage for adult children. So they would either, need to obtain their own individual health plan, or they would receive COBRA, COBRA notification, they can take COBRA.
What if they were disabled?
If they're disabled, they can continue on the Blue Shield policy. You just need to provide proof that they're an IRS tax dependent and a medical authorization. And then Blue Shield reviews it and, approves it, and then they can continue.
And they must be disabled when they reach their over age, correct?
Correct, yeah. They have to be, they have to be disabled at that point. Because the Blue Shield will have to authorize it.
There was some verbiage before, something like if they're a full-time student, they can extend that one, or is it the age limit now?
Yeah.
They're not no longer contingent to become a full-time student?
Yeah, it's healthcare reform extended over age status to all group employer plans regardless of being a full-time student
Yeah.
or married.
Okay.
So they can be on your plan up to age 26, as long as they don't have other coverage. If they have other coverage, then they're no longer qualified for health insurance under the college plan.
Are you talking about under 26? Oh,
Yeah, well, between 19 and 26.
yeah, we would allow them.
Even if they have other
Mhm.
coverage.
Yeah.
So Sis
Yes, we do.
So
Yeah.
dual coverage?
Right. We just say if they're your child, if they are your child,
That's
whether
unique.
adopted. Yeah, and it's because of the grandfather, you know, we have so many plans, we just decided with healthcare reform that we were going to not consider any of our plans to be grandfathered and therefore open it up to everyone. So if your child's under age 26, they can be on the plan. Yeah, you just need to provide proof of eligibility, a birth certificate or adoption paperwork. Yes.
Is it still true that for the vision and the dental, that it only supports you in California?
Well, for the DHMO, you would need to pick a primary dental office in your service area. And so it could be in other areas, but for HMO, it's not available outside California for the medical. DHMO is available only in California. The Delta Dental can be used anywhere. So if you do reside, if you move outside of California, then you need to make sure that your medical and dental are a PPO plan. The vision is a PPO plan, so it's available nationwide.
But is it more than, I was told the last time I tried to get, claim the dental, that it was only a $25 reimbursement for an emergency outside of California.
Right, so under the dental DHMO, that's like an HMO, that's available in California, so you would have emergency services when you're outside California. If you're gonna move and reside, then you need to switch to Delta Dental because you wouldn't have access to the DHMO plan except for emergency.
Or if you're going to travel outside of California, you don't have to move, just traveling.
Yeah, just traveling. Then when you're traveling, it's emergency services.
And you only get $25. Okay.